Please start, Dr. Aditi.
Okay, ma'am. So I will be taking the next session, which is quality assessment in systematic reviews. Is my screen visible? I'll just share. Huh. Now is my screen visible? Yes. So now Chenika has already taken risk of bias assessment. We will move on to the next part, which is quality assessment of observational studies. So basically, like Chenika also said, we have done all of these different things till now. We identified our research question. We wrote a protocol. We searched for the studies using the search strategy. After that, we screened all of our studies first through just the title and abstract and then through full text screening. And then we extracted the data from our studies. So now you are finally on this part, which is assessing the quality of studies. Okay. So what is critical appraisal or quality assessment? So as you have already learned till now, all the systematic reviews, they need one of the crucial part is critical appraisal of the studies that we are going to include in our meta-analysis. So when you read different manuscripts of systematic reviews, you will see that this critical appraisal is given various different names like risk of bias assessment, critical appraisal, assessment of study quality, assessment of methodological quality, or just simply saying quality assessment. So what is the purpose of this quality assessment? Basically, using this quality assessment, we are assessing whether the methodological quality of the study that we are including in our systematic review, that methodological quality, is it good or not? And we are also going to determine the extent to which the study has addressed the possibility of the bias in its design, like in its method section. Okay, so this critical appraisal, it allows the reviewers to answer the question of how well a study was designed. So how is this critical appraisal or quality assessment different from risk of bias assessment? So basically, in risk of bias assessment, what we saw how much the bias is affecting our results, right? Whether our results, whether we have overestimated our measures or we have underestimated our measures, right? 1 second. Yes. So in risk of bias, we are seeing how much the bias has affected our results. In quality assessment, we are not doing that. We are basically seeing the methodological quality. How sound the methodology of a study is, we are checking using our quality assessment. So we are checking if some safeguards have been put in the methodology of the study in order to address the systematic errors. So one would say, why are we doing quality assessment instead of risk of bias? Because clearly what we are dealing with in our systematic reviews, we want a pooled estimate. So we are basically concerned with the results of the studies that we are including in our systematic review. However, what I am saying is we are doing quality assessment for the observational studies, right? So why are we doing this? There are few reasons. So one of the reasons is that quality assessment is comparatively easier as compared to risk of bias, even though risk of bias is superior to quality assessment. Apart from that, till now, we do not have any nice peer-reviewed tools for risk of bias assessment of observational studies. Okay. And in observational studies, we are basically thinking that maybe if all the methodology is sound, if all the safeguards have been put to address the systematic errors in the methodology itself, it would not affect the results, right? But we don't directly measure how much overestimation or underestimation of the effects we are doing in the results. Okay. Is it clear till now?
Yes, ma'am.
So Let me reiterate. In quality assessment, we are just checking if the methodology is sound or not. We are not checking if having that sound methodology and having those safeguards in our methodology, is it really affecting the results or not? If the results are closer to the real estimates or not. We are not checking that. We are not checking how the bias is affecting the results. We are just thinking that if our methodology is sound, the results will not have bias in them. Okay. So there are different tools which are used for quality assessment of observational studies. Some of the most used tools are these two. One is Johanna Briggs Institute JBI checklist and second is Newcastle Ottawa scale. Apart from that, we also have NIH quality assessment tools, critical appraisal skill program tools and strobe checklist, which you must have used these for your journal clubs. Okay. Why are we studying about all of these quality assessment tools? Because like we have guidelines for reporting of different studies. In the same way, we also have guidelines for reporting of systematic reviews. This guideline, basically the checklist which we are following is the PRISMA checklist. And in the PRISMA checklist, item number 11 clearly states that whatever methods we are using for assessing the risk of bias in the included studies, including the details of the tools as well as how many reviewers they assessed each study and whether they work independently or not, all of this. And also if you use some automation tools or not, all of this has to be stated clearly in your manuscript. Okay. So it is necessary to know what quality assessment tools need to be used, how risk of bias is done, like Chenika has told you, and how many reviewers need to do this quality assessment. So like before this, we saw while screening of the studies, we needed at least two separate reviewers who were screening the studies separately. In the same way, for the quality assessment as well, we need two different reviewers who are going to do the quality assessment in duplicate but independently from each other. Two reviewers will be doing the quality assessment and deciding whether the quality of the study is good, moderate or poor. And depending on the results, after that, we will decide whether to include that study or exclude that study. And if there is any discrepancy in the quality assessment of the two reviewers, we will decide how to tie break. Okay. So now moving on, in this session, we will learn more about the JBI critical appraisal tools. Okay. So these JBI critical appraisal tools have been formed by Johanna Briggs Institute and its scientific committee after an extensive peer review process. Okay. And although they have been specifically designed for systematic reviews, we can also use them for journal clubs and as educational tools. So usually you use strobe checklists for your journal clubs in observational studies, but you can also use this Johanna Briggs Institute checklist. Okay. And in the same way that we saw in risk of bias assessment, the JBI checklist also has some signaling questions which prompts the reviewer to identify whether the methodology is sound or not, whether there have been safeguards in the methodology in order to address the systematic error or bias. Okay. So as you can see, this is the dashboard of the JBI Johanna Briggs Institute checklist. So you can see there are different checklists. There one for analytical study, case control study, and different observational studies. And also you can see there are different checklists for RCTs, quasi-experimental studies as well. However, we do not use JBI checklist for anything apart from the observational studies. Why? Because this JBI checklist is a quality assessment study and we already have a risk of bias assessment checklist for RCTs, right? So since risk of bias assessment is superior to quality assessment, we would always prefer the other checklists like ROB tool. So first checklist which we will talk about is this JBI assessment checklist for risk of bias of analytical cross-sectional studies. Why are we talking about this first? Because all the other checklists which we will see 4 checklists, one for analytical cross-sectional study, one for cohort studies, cross-sectional prevalence studies, and case control studies. So you will see out of these 4 checklists, this checklist for risk of bias assessment of analytical cross-sectional studies. You can see in the title itself that this is a risk of bias checklist. Okay. So other checklists are quality assessment checklists. However, what JBI decided, since we do not have any good peer-reviewed checklists for risk of bias assessment of observational studies, and since I'm already telling you that risk of bias assessment is superior to quality assessment, so JBI decided in 2026 that they will revise their checklists and make them so that you can do risk of bias assessment along with the quality assessment. 1 second. Just give me a second. Sorry, am I audible? Yes. Okay, so what JBI decided that it would revise its checklists in order to also do risk of bias assessment along with the quality assessment. So in 2026, it revised one checklist, which is the checklist for analytical cross-sectional studies, and made it so that you can do risk of bias assessment as well. So what they have done, they have divided the questions into a few categories. Okay, so first 6 questions, like there are 8 questions in all, but first 6 questions they have divided as they are related to internal validity. Okay, so this is one of the domains of bias which it will be addressing. Apart from this, there are also other questions which we will see in detail once we go forward. So there are 8 questions in this risk of bias assessment checklist for analytical cross-sectional studies. And I've also included how you can cite this study, this checklist. So whenever you are doing your systematic review and you use this checklist, you have to cite this as well. Okay. Okay. So let's start one by one. So the first question, as I already told you, first 6 questions are related to internal validity. So whenever you go for this, whenever you go on this JBI page where you get this JBI checklist, you will find that there is a checklist as well as there is a guidance document along with it in the same PDF. So it is always advised, even if you are a pro who has done quality assessment using JBI checklist n number of times, it is still advised that you go through the guidance document while doing this quality risk of bias assessment. Okay. So as you can see, there is this first question, which is, were the criteria for inclusion in sample clearly defined? So in the guidance document, the JBI checklist states that this domain is related to bias related to selection and allocation. Okay. So what does this really mean? Whenever you are going through an observational study, if the inclusion criteria are properly defined in the manuscript itself, then you will say as yes. Otherwise, you will write as no or unclear. Okay. Then second question is, were objective standard criteria used for measurement of the condition? This is also for internal validity, and this addresses the bias related to selection and allocation as well. However, this is important that this is at the selection level. So basically what this means is, if we are taking some, we are taking a sample from the population, at that point, when we are defining that, suppose my population is people who have chikungunya. So when I'm taking the sample from that population, have I properly defined how I'm going to decide if this person has chikungunya or not? Whether it was using standard criteria like ELISA, IgM antibodies or not, or just depending on the clinical criteria. Okay, the clinical triad, if it's present, then I'm saying that it's chikungunya instead of doing all the tests or not. Okay, So if I'm using standard criteria, then it will be yes. Otherwise, it will be no or unclear. Is this clear? If at any point you feel like this is getting little bit confusing, just let me know. Okay. So third question is, this one is related to classification of exposure. Okay. So third question is, was the exposure measured in a valid and reliable way? This is for all the associated factors. Okay. Again, in the same way, you'll have to go through the manuscript and you will have to see if the exposure, if it's an analytical cross-sectional study, if you have groups in which you are comparing and all, you'll have to see if both the groups have been measured, the exposure has been measured in the same way or not, or if they are following any standard criteria for the same or not. Apart from that, the fourth question is, were the outcomes measured in a valid and reliable way or not? See, this is very similar to our objective standard criteria used for measurement of the condition. However, you have to know that this question is for outcomes, which is afterwards, like after selection of the population, and then afterwards we are seeing how much prevalence of some associated factor is there or not. And at that point, we are seeing if the outcomes that they have used, are they being measured by standard criteria or not? Okay. If they are, then you will write yes. If not, then no or unclear. And you like you can see here, it's written outcome 1, 2. In the checklist itself, there are 7 different outcomes that you can write yes, no, or unclear for. So every outcome that you are that you are going to have a pooled prevalence for in your SRMA, each outcome you have to tick here if it's yes or no or unclear. Okay. Fifth question is, were the confounding factors identified? At this point, it's just if in the manuscript they have identified the confounding factors, then you will write as yes. Afterwards, if they have done something, if they have used some strategies to deal with the confounding factors, like what are the different strategies for dealing with confounding factors? Can anybody tell me? Okay, so different methods like stratification, excluding the people with the confounding factors, or at the analysis stage, if you want to do regression, all of these ways, if they are using in the manuscript itself to deal with the confounding factors, then you will write as yes. After this, last 2 questions. One is for statistical conclusion validity, and it says, was appropriate statistical analysis used? So you will have to make sure that the analysis which they have done it properly or not, and is it appropriate or not. If in the objectives they are stating that they want to see association, however, no association has been checked in the method section, then you will write as appropriate analysis is not done. No or unclear. If it's done, if you think that proper statistical tests have been used, proper regression has been done, then you will write it as yes. Then, were the subjects and settings described in detail? This is for all the demographic details and all the baseline characteristics. Were they described in detail or not? If they are, then yes. If they are partially, they have given the details, or only few details are given, you will write as no or unclear. Okay. So next checklist which we are going to see is JBI checklist for case control study. Here, in contrast to the JBI checklist for analytical studies, this one is a quality assessment checklist. Once we go forward, you will see how it is different from the analytical studies checklist. Okay. So this one, it has 10 questions. This is how you can cite it, like I have shown you in the first point. And also here also the answers are yes, no, unclear, or not applicable. Then how is this checklist different from the checklist for analytical studies? So here you will just see there are 10 questions which are there in this checklist. For each question, you have to write as yes, no, or unclear. They have not divided it into whether it is which domain of bias it is addressing, that they have not shown. Which questions are related to internal validity, external validity, statistical validity, and all, that they have not divided the questions into. Okay. So, first, you can see, were the groups comparable other than the presence of disease in cases and one second, or the absence of disease in controls. Okay. So basically, for this, you have to not just see if the groups are comparable or not. You also have to see if the groups are representative of the source population or not. Okay. Source population of what? Source population of the cases. Okay. So you have to see if there is individual matching or not, or just in general, you have to see if the groups are comparable or not. Apart from this, the second question is, were the cases and controls matched appropriately? If the manuscript has mentioned properly, if they have done group matching or they have done individual matching, and for which factors they have matched the cases and controls for, right? So if all of this is there, then you will write yes. Otherwise, you will write no or unclear. Then, were the same criteria used for identification of cases and controls? This is also at the recruitment stage. Okay. So, were the same standard criteria used for identifying the cases, right? And were the same standard criteria used for diagnosis of the controls? Diagnosis what? That they do not have that particular disease. Okay. Were the exposures measured in standard, valid, and reliable way or not? This is also self-explanatory. Next question is, were the confounding factors identified? Here also, first, just in the manuscript, have they identified the confounding factor? For that, you will write yes or no or unclear. And then you will write if they have used any strategies to deal with this confounding factors or not. So these are two different questions. Then, were the outcomes assessed in the standard, valid, and reliable way for cases and controls? Again, same. This is also pretty similar. Like the questions are very similar for the analytical cross-sectional studies and case control study. However, just here you will see that they have not been divided into different categories of domains of bias. Okay. Then, was the exposure period of interest long enough to be meaningful? Okay. And was appropriate statistical analysis used? Then, next is for cohort studies. You can find all of these checklists on JBI, the website for the JBI checklist. If you just search for JBI checklist, you will find JBI critical appraisal tools, and all of these checklists you can find there, as well as the guidance document. So we won't go into very much detail, but here also there are 11 questions. And again, yes, no, unclear, or not applicable answers are there. Again, we have first question, were the two groups similar and recruited from the same population? This is pretty similar to the case control studies. Then, were the exposure measured similarly to assign people to exposed and unexposed group? Again, here we are going to just measure the exposure. We are going from exposed to disease, right? So first questions will be mostly about exposure. Third question is, was the exposure measured in a valid and reliable way? First, we are seeing if the same criteria is being used for measuring the exposure. And second, we are seeing if it's reliable criteria or not. Then again, if the confounding factors were identified and if the strategies were used to deal with the confounding factors. Okay. Were groups participants free of outcome at the start of the study? This is very important for cohort studies. Why? Because in the start, in order to recruit the participants, you have to make sure that at the baseline, the participants do not have the disease, right? So again, were the groups or participants free of the outcome at the start of the study? Were the outcomes measured in a valid and reliable way? First, we are seeing exposures were measured in a valid and reliable way or not. And now we are seeing outcomes were measured in a valid and reliable way or not. Outcomes can be anything based on your research question, basically. So sometimes outcome can be death, outcome can be disease, outcome can be anything which you write in your research question. Okay. Then was the follow-up time reported and sufficient for to be long enough for outcomes to occur? So this has two parts. First is, was it properly written or not? And later in the results also you will have to check if for the same time only the follow-up was done. Then second thing, you'll have to decide if it was sufficient enough. So if it's a very chronic disease or it's a chronic exposure leading to disease very late, and then in the methodology they are saying no, we will only follow up for 1 year. But you as a systematic reviewer realize that this is not long enough time to develop the disease. For example, if we are seeing radiation exposure and some sort of cancer, so you'll also have to see if the follow-up period was sufficient enough. Then, was follow-up complete? And if not, were the reasons to loss of follow-up described and explored? Both of these things. First, was it complete? And if they have done anything, the reasons for loss of follow-up have we mentioned, or they have done something to reduce the loss to follow-up. All of that they have to write in the manuscript. If it's written properly, then you'll write as yes. Otherwise, you will write as no or unclear. Were the strategies to address incomplete follow-up utilized? Again, if there is loss to follow-up, are they doing something to deal with that loss to follow-up? Are they doing something to aggressively follow up the people who were recruited in the study? And last is same as all the other checklists, which is, was the statistical appropriate statistical analysis used? Okay. Last one is checklist for prevalence studies. Here we have 9 questions. Answers are yes, no, unclear, or not applicable. Same as the others. Okay. Then, in this, first question is, was the sample frame appropriate to address the target population? So many times when you're reading all these prevalence studies, you'll realize they have just said that this much population was recruited, but how they have come to that sample size, they have not told. Okay. So was the sample frame appropriate? That they have to write. Were the study participants sampled in an appropriate way? Like it was random sampling, systematic random sampling, all of that they have to write properly. If not, you will write as no or unclear. Was the sample size adequate? Sampling frame is basically, it's not the same as sample size. Sampling frame is basically all the list of people that you have from which you are taking the sample. So was it appropriate and was the sample size adequate? Were the subjects and settings described in detail? So all the demographic details of the subject as well as the setting where you are doing the study, is it properly described in the manuscript? Was the data analysis conducted with sufficient coverage of the identified sample? So you have to check this. You have to check in the results actually. Every time when you read a table, you will see in the top this n is equal to something. So you have to check if all the data analysis has been done using all of the people who were eligible, who were in the sample, or they have done some subgroup jiske andar they are doing the data analysis. Okay. If they have taken a subgroup, if they are not taking the entire sample for that data analysis, you will write as no or unclear. Otherwise, you will write as yes. The valid methods used for identifying the condition. Again, like we saw just now in the earlier checklists, here also we need standard criteria for assessment of the outcome. Here outcome is the condition. Okay. Was the condition measured in standard reliable way for all participants? So all of the participants, if the same method was used or different methods was used for different participants, this is 7th question. Was the appropriate statistical analysis? Fairly simple. And was the response rate adequate? If not, was the low response rate managed appropriately? So whenever there is a sample size calculation, you will see usually there's we take 10% extra sample or 20% extra sample in order to say that even if low response rate is there, we will manage it appropriately. So was that done or not? And if the response rate was low, did they try to have the adequate response rate? This is the 9th question. If they have mentioned properly in the manuscript why there is some missing data, why the response rate is low, then you will write as yes. Otherwise, you will write as no. Okay. So this was all of the details about the checklist. However, this doesn't tell us how this checklist need to be used. So what JBI says is that the checklists just need to be used as is. There is no grading system according to JBI. Okay, they think that the two reviewers who are doing the critical appraisal, they should decide whether the checklist, like the questions, they are yes, no, or unclear. And after that, they should individually come to a consensus whether the study is good quality, moderate quality, or poor quality. Okay. So, two different reviewers should take the decision on their own and decide if the quality is good, poor, or moderate, or has high risk of bias, moderate, or low risk of bias. And then they should sit together. And whenever there is discrepancy, like if the two different reviewers have given different quality for one study, then they should sit together and try to do have a tiebreaker. They should try to come to a consensus whether to decide this is a good quality study or bad quality study, and also to decide whether the study needs to be included in the systematic review or not. But all of this has to be written in your protocol in the like earlier in your protocol itself, like what you will do if there is discrepancy regarding quality of studies, what you will do if the quality of study is poor, whether you include it or exclude it. However, this only sounds good in theory, but it's not very practical when you use these checklists. So many times what the reviewers do for practical purposes, they usually have a scoring system. So as you can see on the screen, generally what is done, that they decide that each yes will get 1 scoring, no or unclear will get 0 scoring. Okay. So, but also again, this has to be stated in your protocol earlier itself, how you will score the checklists and how you will deal with the tiebreakers. Okay. So many times this is done. So after scoring, as you saw, there will be different scores, like depending on the number of outcomes, like outcome 1, 2, 3, 4, the number of yes out of all the questions will differ. Okay. So what you will do at the end, you will take a total score of how many yes were there. Okay. And how many questions were there. And you will calculate a percentage of how much score that study has received. Okay. If the study has 80 to 100 items have been scored as yes, then it will be considered as low risk of bias. 50 to 80 if they are yes, then that will be moderate risk of bias. If 20 to 50 items are scored as yes, that will be high risk of bias. Again, all of this scoring system has to be put in your protocol. Also, how you will categorize the studies for risk of bias or quality, that also has to be told in your protocol. Also, what you will do with the high risk of bias or low quality studies. Sometimes what we do in the systematic review, after doing all of this quality assessment, we decide that no, we want to include even the studies which are poor quality. Why? Because if we are excluding studies with poor quality, we are ourselves introducing a little bit of bias. Okay. So now you are thinking, why are we going through all of this big quality assessment thing if we are going to include all the studies that are poor quality also, right? Are you thinking this? Yes, no? Okay. So basically, what we do, quality assessment is not done exclusively. Like Chanika also said, there is some other thing known as certainty of evidence, for which we have the grade framework. What is certainty of evidence? At the end of the systematic review, whatever pooled estimates we are getting, how much certainty we have that this is close to the truth. That is certainty of evidence, for which we do grade framework. Okay. So this quality assessment or risk of bias assessment has to always be done along with that grade assessment. Like, it's not like we have done all of this, then we don't need to do certainty of evidence. We don't need to see certainty of evidence in the end. We need to use both of these in a systematic review in order to make sure that the input of the studies which we have, that is also of good quality. or that also has an adequate quality, and also the result which we are getting, the pooled estimate which we are getting in the end, that is also adequate and is close to the truth. Okay. So this is one of the photos of a systematic review which has used the JBI checklist in their SRMA. So you can see, like whenever you are you are writing a manuscript for a systematic review, usually in the supplementary material, you will see that they are putting all this quality assessment also. So you can see they have written all the 9 questions at the top. 9 questions is for checklist for prevalence studies. Okay. So they have written all the questions on the top. For each study, they have put yes, unclear, no, all of this. Okay. And in the end, they have written the scores also. Okay. If you don't want to do this, this is what we had done in our systematic review. We had done a systematic review on prevalence of cutaneous manifestations in chikungunya patients. Okay. So for that, what we did all the Q1, Q2, Q3, Q4 ऐसा वाला table. And then for each question, for each study, we wrote yes or unclear or no. Okay. And in the end, we just wrote a remark whether to include or exclude that study. So earlier when we did this university seminar, we had also done the hands-on practice. However, we won't be able to do that now because we don't have the checklists here, like, and no way to share the checklists. But if you just look for this JBI manual for evidence synthesis and go to the critical appraisal checklist, you will find all the checklists over there. I would suggest you just download any observational study that you can find, and you download this checklist from that JBI website and just try to do it on your own. Okay. So that's it for my session. Does anybody have any questions? No?